All right, welcome to Life Extension Live. I'm Dr. Mike, and that is
Dr. Crystal.
Thanks for joining us today. Now, today we got a pretty serious topic.
Yes.
Right? We're going to be talking about chronic pain. This is a big issue for a lot of people in this country, really everywhere, right?
Yes.
And, sometimes the choices of how to treat chronic pain, they do work. We're talking about the opioids and stuff like that, but they scare a lot of people. They come with a lot of side effects. So we wanted to talk a little bit today about how what are the things you can do to manage that. So on today's show, we're going to be talking about what is chronic pain and ultimately how you can manage it, right?
That's right. And we're logged in live and ready for your comments. So feel free to chat with us.
Yeah.
We thank you for joining. Give us a shout out. Tell us where you're joining from.
Ask a question.
Yes.
All that kind of good stuff. All right. So we're going to get right into this pretty quick. I have a disclaimer right up front.
Okay.
Chronic pain is complicated, right? And although there's a lot of good research out there helping us to understand how and why it develops, it involves multiple parts of the nervous system, right? And so just keep that in mind. It's complicated. So we're going to do our best to help you kind of break down what is chronic pain, really by looking at 4 kind of steps, right? Yes. But realize there's a lot more to this.
That's right.
Right? But knowing these 4 steps is going to help you to understand a little bit more some of the nutrients and stuff that we do. I do want to mention too, it's really considered a disease by itself now.
Yes. Yeah, it has its own disease code. And so we are understanding that while it's always important to look at a root cause of something, once you get into that chronic pain cycle, you need to find a practitioner that's going to help you to just simply manage that pain.
Right. I'm going to give this is the classic definition of chronic pain. Chronic pain is defined as persistent or recurrent pain lasting longer than 3 months. So that's not the acute stuff, bump my elbow and it hurts type thing.
Yes.
It has to be persistent, and in many cases even getting worse over a 3-month period.
Exactly. And what's happening, and we will look at those steps, but let's say you injure your knee, and we'll take a look at an injured knee. But usually within about 3 months there's going to be inflammation. Hopefully you're kind of properly rehabbing that knee at home, icing, warming, resting.
Doing what you got to do, right?
Doing, the following the steps to manage inflammation. And that inflammation should then subside.
Yeah. But when that doesn't happen, we're learning that there's reasons for that.
Right.
There's reasons for that persistent pain that we're going to show you. But again, it has to be over 3 months.
Right.
So let's take a look. We have a nice little graphic for you. Let's take a look at this. Now, before, it's a little overwhelming. Just hold on. Right, Doctor? Just hold on. Do you want to kind of walk us through what's happening at the knee to the brain? Is that kind of?
Absolutely. Yeah. So what you're seeing, and we'll start at the very bottom of this graphic where we see the image of the joint, the knee joint, and there's trauma. Who knows what happened? Maybe you went out for a run and now there's trauma to that knee joint. You have activation of those nerves in the periphery of the body, or those nerves outside of the brain and the spinal cord. So these are the nerves extending out all the way down to the knee. It's transmitting the signal up through the spinal cord,
which is that middle part,
which is kind of the hub.
Yeah, that's the hub. That's good because a lot happens here.
There's a lot going on at the spinal cord, and from there, it's inputting that signal. Something's wrong to the brain. And so we feel the pain. That's how we are feeling that pain. The pain is being recognized in the brain, and then the brain tries to manage it.
Right, exactly.
The brain starts creating endorphins and different brain chemicals to try to relay back down. That's to the right where we're having the modulation, relaying that information back to the spinal cord to say, it's okay.
Yeah. It's okay. It's not as bad.
Right. So
we're going to calm this down.
This is the brain trying to offset that signal that's coming from the knee to give you some type of comfort and relief.
And so in acute setting, you're not moving on to chronic pain. At this point, there's healing. You start to see resolution of the inflammation. All the nerves calm down. And then that's it. You're fine. But If it's over 3 months, here's what might be going on. Just consider everything just to be oversensitive, overactive, and amplified.
Yes.
Right?
Right.
Go back to the picture real quick, Hannah. If you look at the peripheral nerves there, they become oversensitive. They're like really just still firing, and for some reason, it's like, why are you still firing? But they are, and there's research looking into that, like what's propagating that. But ultimately, they're overactive, right?
Right. They're responding to just the slightest touch.
Yeah.
It's
too much,
it's
right? Yeah.
just a mild sensitizing thing it's amplified like it's a burning fire.
Yeah, it's almost like, when you have like a shirt on, like, or a sleeve, over time after you put it on, you don't feel it because the nerves get used to it,
yes,
right?
That's a good
But
example.
in a chronic pain situation, those nerves don't get used to it. They're constantly feeling it. There's constant irritation. Now, that signal is going to continue on into the spinal cord. And what does that hub do? Remember you call it the hub?
Yeah.
This is where everything gets amplified now. That spinal cord's like, something's going on. And it really revs up and sends even more signals to the brain.
Right.
Right? And now in the brain starts to get sick of it. The brain is like, I ain't even going to pay attention to this anymore. And that's what we call resistance, meaning the brain now is not sending as many calming nutrients, calming neurotransmitters back down to the spinal cord. And so now you just have this very active, very amplified signal system. That's, to our best of knowledge today, that's chronic pain.
Right. And so many people are dealing with this. And we wanted to explore and kind of explain what's happening. Number one, because this will help you to understand why many things you're trying may not be working. And sometimes you have to come at this chronic pain from different levels.
Yeah. Periphery, cord,
overall
brain,
inflammation, targeted at the brain, and combine all of those things. And unfortunately, we're not finding that there's a comprehensive approach to assist people with managing their pain. And we're here to kind of give you some of those steps.
I mean, let's look at two very common uses or drugs, right, for this. One are your NSAIDs, your ibuprofens, aspirins, all that kind of stuff. Well, they're just working on systemic inflammation, basically,
right?
Which is important to do. But what about everything else, right?
Right.
Opioids are all about in the brain. They're sending more signals back down. Great, but are you dealing with the overamplification of the spinal cord? See, there's different things you have to consider. So those opioids and NSAIDs have a role and they can be effective, but they're not comprehensive in how they are treating that chronic pain.
Very true.
Yeah. So let's talk about, I think before we get into lifestyle and nutrients that could help, let's put that image up one more time, Hannah, for me. Keep this in your mind, right? Because we're going to talk about where lifestyle, nutrients, where they're affecting this process.
Yes.
Okay? And we think that kind of comprehensive approach is best. Okay? But before we do that,
we have a question.
Go ahead.
A burning question. Because, we have a team that's giving us questions that you're asking. And one question that the people want to know is how soon should we seek pain management? Yeah. And what's as a clinician, what do you think my answer is? Right away. Right away. I mean, listen, if things aren't healing, I mean, let's be honest. If you injure an ankle, a knee, whatever it may be, maybe you pulled a muscle, whatever it is, you should, with any of that stuff, within a week or so, you should start feeling better. Right? You should get more range of motion back little by little. You should have to use maybe less of the NSAID, less of the ibuprofen, that kind of stuff, right? If it's been a little over a week and things aren't getting better, go see your doctor. Right, and that's the thing. But that is we're assuming that you are resting. Doing the right stuff, right? Trying to move it, that you are trying to manage it with lifestyle, with diet. So that's with that assumption, Dr. Mike. Right. And so let's get into this. Yes. Let's talk about this. We're going to talk about, and again, we're not saying, if your doctor has prescribed something, you do what your doctor has said. We're not, so this is not saying stop anything.
We're going to just discuss some things that you might want to add. Talk to your doctor about this, right? All of this could work in conjunction, that
Yes.
comprehensive approach.
That's right.
So we have lifestyle. We're going to talk about some over-the-counter medications. These are types of pain management. You can see it there on the screen. And then, of course, Dr. Crystal's expertise, nutrition. Let's start with lifestyle and functional management of pain. When we get it, we're going to talk about a bunch of little things here. Trial and error is the key. Some of this may work for you, some of it may not. You just have to try a little bit and see what's best for you. The first one makes sense to me, and that's stretching.
Right.
Stretching the area. There you go. There's a nice. Can you do that? You could do that.
I can do that.
I think you could do that.
I can.
I used to, but not anymore. Studies have found that when you're stretching, especially that area that's been injured, when it's ready to be stretched, don't re-injure yourself. But studies have found that when you stretch that area, you can see reductions in pain from muscle issues, joint issues, even headache.
I know. I thought
Isn't that
that was
interesting?
interesting.
Yeah. We think the stretching has to do with increasing tolerance in general to pain, but it's good overall for better flexibility. And I do think stretching. This is kind of my little 2 cents about it. Dr. Chris always laughs at me a little bit when I do my 2 cents. There's this idea in medicine about it's called hormesis.
Oh,
It's a little bit of a stressor, can actually activate healing and stuff like that. I think that's what stretching's doing. You're starting to stretch over that injured area. You're kind of challenging it a little bit. That actually activates some good healing process.
I like that.
Hormesis. Look it up.
Hormesis.
You want to talk about food and diet.
Of course, I have to talk about diet. What you eat makes a big difference on, one, your body's ability to heal, right? Giving you those nutrients, the core vitamins and minerals that's involved with the healing process, making sure you're getting lots of protein that's needed for healing.
Yeah.
But we also know that the SAD diet, what you're seeing there, that's
not the SAD diet.
That's not the SAD. That's the good diet. That's a kind of imagery of the Mediterranean diet, fatty fish,
our favorite,
green veggies, making sure that you're sitting down and you didn't see someone scarfing down salmon in their car.
Yeah.
Like they're at a table, they're sitting, they're with their family. But the one thing that we know is the SAD diet, the standard American diet or the Western diet, is pro-inflammatory.
For sure.
Pro-inflammatory molecules in your body will amplify pain. We do know this. Cytokines, they
well established in the
literature. So if you are trying to manage pain, then you need to manage the overall inflammatory state in the body, and you do that by making sure you're getting fatty fish, the omega-3 fats, cooking with herbs, lots of spices, the sage, the ginger, the garlic, the turmeric.
Love it all.
Right?
Love it all.
The basil. I can go on and on.
I know.
Right,
She will. She's going to make me hungry. Yeah.
The time.
Yeah.
Making sure you're cooking with those spices, using the fresh herbs when you can, and that helps to decrease the overall inflammatory
Did you say spicy
state.
chilies too, right? Capsaicin?
Oh, yeah.
That's huge.
All of the above.
Yeah,
right.
that's all good. So, you got to eat right. It forms the foundation of healing.
Right, and limiting the pro-inflammatory foods.
Right. Okay, that's awesome.
Yeah.
Exercise. Now, again, I went from stretching to exercise. That's pickleball. I'm actually pretty good at that.
Oh.
Yeah. Of course, that's against my sisters, and they're a lot older than I am. They don't move as fast anymore, so I can whip them easy. All right, back to what I'm talking about here. Stretching and exercise. The theme I want to get across though is you got to do this when your body's ready. I know you. I'm gonna pick on Dr. Crystal a little bit. She's a go-getter. She does all kinds of exercises. I don't know if you ski, but she does all kinds of exercise. But I know for a fact she's the type that she could maybe injure herself. And she's going to do her best as fast as she can to get back out there. And maybe I've thought sometimes she should slow it down a little bit.
Right.
Make sure you're ready to exercise and stretch. But when you are, exercise can help break kind of that cycle of pain in you. And I know that sounds weird because sometimes when you first start, it hurts.
Mm-hmm.
But again, that's that hormesis.
That's
A little
true.
stressor can actually initiate healing, and over time that'll get better and better and better. So I know a lot of people when I was practicing medicine would say, well, I really can't exercise because my knee is so bad, it hurts so much. I always like to flip it and say, well, maybe your knee hurts so bad because you don't exercise.
So true.
Flip
If
it.
you can get moving again, that makes so many things better. Plus, exercise increases those endorphins, those
Yeah.
same endorphins that
Makes
the
you feel good.
brain
Yeah.
produces to kind of tell the central nervous system or to tell the spinal cord that, hey, the pain's not that bad. So
Yeah.
you can also get that high from the exercise. Now, I do want to talk about acupuncture.
Mm-hmm.
We've talked about this on shows in the past.
We
even
did
had
it.
a live show,
We did it live. Yeah,
a live
we got it
demo.
done.
So
Yeah.
you should look for that show. But there is research, a meta-analysis of 39 trials concluded that acupuncture is effective for the treatment of chronic pain, with treatment's effects persisting over time, and that the decreases in pain following acupuncture treatment can't be explained by the placebo effect.
Right.
So acupuncture is something that you should try. I have a close friend that posted a picture yesterday of herself getting acupuncture for some chronic pain she's been dealing with, and she says
It's working
it's
for her.
it's working
Yeah.
with her, along with
Good.
other things. And this is not a one
I like what you said.
one
Other
sh-
things.
other things is
things.
needed.
Comprehensive stretching, exercise, good diet.
Yeah.
Add some acupuncture. You might even want to try something called TENS, transcutaneous electrical nerve stimulation. Now that sounds horrible,
But it doesn't
but it's
look
not.
horrible.
That's all it is. It's real simple. This can help break the cycle of pain. It's a wearable device. Basically, it interferes with the ability of the nervous system to transmit pain signals and stimulates endorphins. A meta-analysis of 91 trials. Remember, a meta-analysis is where you group trials together so you can trust the results a little bit
Yes.
better, right? More people, more data, more confidence,
Yes.
right? 91 trials is pretty good, right? They concluded that pain intensity was less during or immediately after TENS treatment in comparison with placebo. And then and another meta-analysis of 61 trials found that it actually produced less pain over time as well compared to placebo.
That's right. And I know people, Dad, you have your
Your dad-
TENS
what?
unit. My dad.
Oh, he does?
I remember he had this the longest time before I knew anything about it. And so people start using them. You're excited when you get your TENS unit and you use them, and then you put them away.
That's your dad.
Pull it back
That's
out.
true.
And remember, it's not a fix-all.
Yeah.
You have to combine these with
You
the
gotta
other
combine them.
strategies.
Yes,
But
and-
it can be helpful.
And we need to tell
There's
your
the
dad.
research.
We need to tell your dad that when a device is in the cupboard or whatever, the drawer, it's not going to work. That you got to actually use it. Just like when we suggest nutrients, you got to actually take them. We suggest the
That's
good
right.
food, you got to actually eat it. You got to actually do it.
If you look, you have the supplements, get them out of the pantry.
Yeah.
And then, of course, you have the over-the-counter. We
Okay.
get the questions about the creams, the gels, the
Gels.
ointments, the rubs,
Yeah, and
the
you.
soaking
What,
salts.
what is it though? You said olive oil. How is that? What are you doing
It's
with
my
that?
tried and true. It's my secret weapon.
What do you
Olive
do? Like,
oil
what do you-
on my knee.
Oh, like an oil.
So
oh,
I
okay.
buy
Okay.
a bottle of good olive oil, high polyphenol olive oil. Dr. Mike, this is the truth. You ask my
I believe
kids.
you. I believe you.
And at night, it's a part of my, like after I shower, I have my lotion and I have my bottle of olive oil right there. And I just rub the olive oil on my knee, whatever
And
joint,
it helps. So if you're
whatever
feeling,
joint
it does help.
is feeling achy.
It does help.
And it's
Okay.
not an overnight thing, but I do feel like it's helping. And there's research. This is it's not just in my head. I would like to say there's a clinical trial where the olive oil was compared
okay.
to other things.
I'm
and it
not, I
helped.
don't doubt you. I think I'm sure you're all nice and oily and stuff, trying to go to bed, slipping out of bed, right? All that kind of stuff. Now, Epsom salts, also good research. They help as well.
Yes.
Yeah. Now, again, think of those lifestyle choices as a comprehensive approach. Try some of them. For many people, all of them, a little bit of stretching and exercise, acupuncture, olive oil or Epsom salt, all of that can really help. And again, this is not about stopping meds that you're on. It's just all trying to work better to provide more pain relief. Now let's get into some of our favorite nutrients for chronic pain. I'm going to start with the first one because we love it.
I know.
It's curcumin. Now we put this graphic back up. I like curcumin because it's working in two places here. Remember, there's the peripheral nerve, spinal cord, brain, right?
Yes.
So curcumin is helping with the peripheral inflammation, so the peripheral nerves, but it's also helping in the brain. It turns out that it can decrease the inflammatory mediators that are released from the spinal glia. These are cells in the central nervous system that can propagate more inflammation and lead to more like brain signals, although they're not the ones doing the signals. Okay, so I like curcumin because it's working in two spots.
All right, and then omega-3s. They're kind of neck and neck to me. The curcumin has a one-up because of that research with working in two spots, but omega-3s overall can calm the inflammatory state in your body. They help to offset common fats that we receive, the omega-6s that we get in lots of our dairy and our meat and our cheeses. And it helps to just bring more of a balance in the body for the inflammatory state. Sure. With research shows that it can, if you're already dealing with pain, it helps to kind of prevent that pain from getting worse in older individuals. So omega-3 fatty acids, EPA, DHA, high dose, 4 grams.
Eat them, supplement with, I do everything, right?
Yes.
Yeah, and keep in mind, this is just, I think at least if you are dealing with chronic pain, you're looking probably at 4 grams of wild omega-3s. And that's going to be a mix of different types, right? Okay. What about one called Angelica? Right? You like this one? We've talked about, or it's also known as decurcinol.
Right, that is the active component.
It is very strong, and it works really well. It looks like most of the research, although it started out that there might be some brain effect, but most of the research is showing that it's just a powerful anti-inflammatory out in the systemic circulation.
Yep. And then, of course, PEA. And we have another graphic, yes, PEA, that helps to support the connection between the nervous system and the immune system.
Right. Now that's it, but let's explain that, because there's systemic inflammation. That's the good old-fashioned inflammation measured by things like CRP, NF-kappa beta, all that kind of stuff. Yeah. But then there's
neural inflammation,
right?
Which is involving also like mast cell activation as well as the nervous system.
Yeah. It's like immune modulated inflammation, something like that, right? But it's different.
You don't want.
It's different. It's different from just plain old systemic inflammation.
Right. And so I failed to tell everyone what PEA is. The full name is there, palmitoyl ethanolamide, but it's a type of fatty acid that you find in egg yolk, milk, soy, produced naturally in the body. And it's been shown to be very beneficial with targeting the mast cell, and it is targeting step 1 in inflammation.
Inflammation, yeah, but so you add something like you have fish oil, like for instance, right? That's working on the systemic type of inflammation. When you add PEA, you're now working on more of that immune neurotype based inflammation, because both of them are playing a role.
We know that the immune system is what's coming, like when you have that initial insult, that initial injury, let's say to your knee, that's the immune system coming in. Right. That's releasing mediators that promotes the pain. So the PEA is coming and working right at that level.
The last one we want to talk about, you see there on that graph, Hinokiol, right? Remind me what that is again. I just forgot.
It's coming from like a bark. It's sort of the magnolia tree. Okay. So it's an active component, a phytochemical that is found in either the leaves, the bark of that type of plant.
Yeah, and so what it's doing, now this one's working in the brain. Remember, there's peripheral nerves, spinal nerves, brain stuff, right? This is that resistance part we talked about. Remember, when you have all these amplified signals going to the brain kind of shuts off. So it stops making, it becomes desensitized to like the GABAs. the endorphins and those kind of things. Well, Hinocchio is able, apparently, to interact with GABA receptors to kind of reinitiate GABA's calming and pain relieving effect in the body. So that right there, Hinocchio and PEA, great combination. Add maybe some curcumin or fish oil. So now you're working on the peripheral inflammation, you're working on that neuroimmune inflammation, and the resistance in the brain.
All right. So I
like
have
that
a
approach.
question.
Oh, okay. I didn't know.
Maybe I'll answer it too. Where do you think someone would start out of it? So from what all of the information.
Hands down for me.
Where's the best place?
Hands down for me, because I without a doubt in my mind, inflammation.
Yeah.
Remember, inflammation is the foundation of many diseases and how diseases propagate. So I think step one, as a matter of fact, even with an acute injury, slow it up on the anti-inflammatories. Maybe that does that help prevent chronic pain? I don't know. I don't know if there's a lot of research on that. But I would start with, for me, fish oil, curcumin, PEA. Those are your main anti-inflammatory. That's where I would start.
Okay.
What would you?
I would start with food.
Well, wait a second. No, you set me up.
No,
I thought you were assuming we're doing the food.
We're assuming we're doing the food. I agree. I think the curcumin is a good start. The PEA is kind of my next thing. That's assuming that you're getting good 2 servings of fatty fish every day. You kind of have your omega-3s covered. Omega-3 should be in your foundation anyway. Yeah. You know, and
should be, yeah. But you can also increase it a little bit if you've been injured and stuff. But I don't know. For me, it's just you got to start with calming down the inflammation.
I agree.
Because so much from inflammation, so much of it comes, it propagates so much more. A lot of the amplification and all that kind of stuff. That was good information.
Yes. Hopefully you understand what you're dealing with if you're dealing with chronic pain a little bit better and understand the multimodal approach.
Yeah. And so we have, if you want to learn a little bit more, maybe take your time, digest this a little bit better, lifeextension.com/pain will open up Life Extension's extensive protocol. Right?
Yes.
On pain. And listen, that protocol goes into the why and how it develops much more. It goes into the lifestyle and nutrition stuff more, and even gives you all the research with the nutrients at will. That's lifeextension.com/pain. Thank you for joining us today.
Yes.
Please.
Hi, Patricia.
Hi, Patricia. Hey, let us know, if you have any comments or questions. You can always, we keep these up for like a good week.
Yes.
Right. So you can send this to friends. You can share it. They can comment. We have people that will be ready to answer your questions on that. Don't forget, we go live every Wednesday at 12 noon. And go ahead and hit that interested button. Right. If you're on Facebook, it's an interested button. I think it's different because we're on different channels now.
YouTube, you ring the bell.
I don't know. Yeah, whatever. Yeah, there's all kinds of different things.
Just make sure you follow our page.
Follow our page so you always know when we're about to go live. That's 12 noon Eastern time every Wednesday. I'm Dr. Mike.
Dr. Crystal.
Thanks for joining us. We'll see you next time.